15%. That's the most extra a doctor who hasn't signed Medicare's rate can add on top of your bill. And on a $200 service, that's $30 your neighbor never has to pay. Diane and her neighbors saw the same kind of specialist, the same month, for the same procedure. Her neighbor's bill matched what Medicare said it should be. Diane's came in higher, noticeably higher, for reasons she couldn't see anywhere on the paperwork. She hadn't done anything wrong, she'd picked a fine doctor. But that doctor had quietly chosen a different arrangement with Medicare than her neighbors had. And that one choice, made in an office she never visited, let an extra charge land on her bill that her neighbor never had to pay. So what is that extra charge? Why can one doctor add it when another can't? And how do you make sure it never lands on you? Today, in plain English, I'll show you a small word that quietly moves real money. This video covers Medicare assignment and the excess charge. It does not cover doctors who fully opt out of Medicare or Medicare Advantage networks, which work differently. The word is assignment, and here's what it means. When a doctor accepts assignment, they've agreed to take the Medicare-approved amount as payment in full for a covered service. Medicare sets a price, the doctor accepts that price, and your share is the normal 20% after your deductible, nothing extra. And the good news up front? Most doctors, the large majority, accept assignment. For most people, most of the time, this whole issue never comes up. But not every provider signs up that way. A provider who does not accept assignment is called non-participating, and they're allowed to charge you more than the approved amount, up to 15% more. That extra slice has a name, the excess charge, sometimes called the limiting charge. It's capped at 15%, so it can't run wild. But 15% on top of a big procedure is real money, and it comes straight out of your pocket. Let me make it concrete with round numbers, just as an example. Say Medicare's approved amount for a service is $200. With a doctor who accepts assignment, that $200 is the whole story, and you pay your normal share of it. With a non-participating doctor adding the full excess charge, the bill can be up to 15% higher, $30 more here, and that $30 is yours to pay, on top of your usual share. Same service, same Medicare, $30 of difference created by one office's paperwork choice. Now there's a piece of protection some people already have and don't realize, and it's worth knowing which side of it you're on. Certain Medicare supplement plans, Medigap, are built to absorb this exact charge. The plans known as F and G pay Part B excess charges for you. So even if you land at a non-participating doctor, the plan eats the 15%. But a plan like N does not cover excess charges, and if you have no Medigap at all, there's nothing standing between you and that extra bill. So whether this can ever touch you depends a lot on the coverage you already carry. It's also worth knowing this isn't the same as a doctor who has opted out of Medicare entirely. That's a different and rarer situation, where Medicare pays nothing and you're in a private contract. The excess charge we're talking about is smaller and more common. A doctor who still takes Medicare, still bills it, just hasn't agreed to the approved amount as the ceiling. It hides in plain sight because the care looks identical. The only thing that's different is the math on the bill afterward. It's worth seeing the three kinds of provider clearly because they're easy to blur. Most doctors are participating. They accept assignment and the approved amount is the ceiling. Some are non-participating. They still take Medicare and still bill it, but they can add that 15% excess charge. And a small few have opted out entirely. They've left Medicare, so it pays nothing and you're in a private contract. Today's 15% is the middle case, the common one, and the one that hides best, because the care looks identical to the first. So how do you keep from being the Diane in the story instead of the neighbor? It comes down to one question, asked at the right time. Before a visit, especially a big one, a specialist or a procedure, you can simply ask, "Do you accept Medicare assignment?" It's a normal question. Billing offices hear it all the time. If the answer is yes, you're protected by the approved amount and there's no excess charge to worry about. If the answer is no, you now know to expect up to 15% more, and you can decide whether to proceed, look for a provider who accepts assignment, or lean on a Medigap plan that covers it. The power here is entirely in asking before, not discovering after. You can also check before you ever pick up the phone. Medicare's own website has a tool for finding and comparing providers. and it flags whether a doctor accepts assignment, so you can screen for it while you're choosing rather than discover it on a bill. That's especially worth doing for the big, planned things: a surgery, a run of specialist visits, where 15% isn't a rounding error but a real number. A little checking up front on the visits that cost the most is where this knowledge pays for itself. And there's a calm way to think about this that keeps it in proportion. This is not a scam, and a non-participating doctor isn't doing anything wrong. It's a legal arrangement, and some excellent doctors use it. The point isn't to be suspicious of your physician. It's simply to not be surprised. A bill you saw coming is a bill you can plan for or avoid. A bill that ambushes you is the one that ruins a month. The 15% only stings when nobody warned you it was possible. Have you ever opened a doctor's bill that was higher than you expected and never understood why? This is often the hidden reason. Tell me in the comments. I read every one, and your story helps the next person ask the question first. And know the geography of it, because it's not the same everywhere. A handful of states limit or outright ban Medicare excess charges, so in those places, this simply can't happen to you regardless of the provider. In the rest, it can. That's not a number to memorize. It's a reason to ask your own state health insurance assistance program whether excess charges are even allowed where you live, so you know how much this rule applies to you before you worry about it at all. And keep the whole thing in proportion, because it's easy to over-worry a rule once you learn it. For most people, at most visits, every provider accepts assignment, and this never comes up at all. The excess charge is a corner case, real, worth one question before a big procedure, but not a reason to second-guess every appointment or distrust your longtime doctor. Learn the word, ask it once when the stakes are high, then let it go. Knowledge should buy you calm here, not a new thing to fret about. So here's what to do, and it costs you nothing but a sentence. First, for any significant visit, ask the office directly whether they accept Medicare assignment before you go. Second, know your own coverage. If you have Medigap Plan F or G, excess charges are handled for you. If you have Plan N or no Medigap, they can land on you, so the question matters more. Third, if you're told a provider doesn't accept assignment and the charge worries you, it's completely fair to look for one who does. Most do. Ask first, and the surprise disappears. And if you want help understanding your own Medigap coverage, or whether excess charges are even allowed where you live, some states limit them, your state health insurance assistance program, your SHIP counselors, will explain it for free, with nothing to sell. Reach them or Medicare at 1-800-MEDICARE, because the gap between Diane's bill and her neighbors wasn't about the quality of their care. It was about one word neither of them was ever taught to ask about. Learn the word assignment. Ask the question once, and a whole category of surprise bills simply stops being able to reach you. That's a rare bargain in Medicare. One question, asked a single time, closing a door for good. So tell me below, had you ever heard of a Medicare excess charge before today? If this saves you a surprise, subscribe. Next, we look at the Medicare hospital deductible that most people think is yearly, and why you can end up paying it more than once. This is general information, not financial advice, and not medical advice. And we are not affiliated with Medicare, so always check your own situation. I'm glad you're here. I'll see you in the next one.